Now we transition to a special guest here in the studio. Dr. Cameron Webb, the Virginia State Health Commissioner, joins us in studio. This is a special treat for us. Dr. Webb, how's everything with you?
Everything's great. Thanks so much for having me.
Now, we were talking a little bit before we started the interview, and you said it's just over 3 months in your current position. What's it like adjusting to the new job while also having such a heavy responsibility here?
I mean, it's been great. I think the agency it's large, but there are so many incredible folks working here. It's been great to get to meet folks in the community, meet our partners, and then meet the staff. So I think that's been incredible. But I tell people it's pretty similar to my last job as a clinician, where it's a lot of walking into rooms and asking people where it hurts. And so I think that the listening is the key, and that's what I've been focused on this so far.
This is ultimately healthcare all kind of comes back to that, right? Walking into rooms, asking people where it hurts, and trying to help them alleviate that pain. Now, we have you here today to talk about something very specific, something that is specific to, I think, this week in April. Yeah. It is Black Maternal Health Week. It is a time where, we're able to shine a light on some of the issues that affect Black moms and Black maternity. And so I want to start broad, and I want to ask you, if you were to highlight one or two issues that you think are the most important to let people know, are kind of still out there, what would you say?
Well, I think the first is just the harrowing statistics on Black maternal mortality. I have a sister right now who's expecting her first child, and I think for a lot of Black mothers, that question is very real. When you see the statistics and you realize there's a disproportionate impact, you have that fear and you worry, am I going to be one of those folks who doesn't make it through this pregnancy? And nobody should have that feeling. Right now here in the Commonwealth, about 2.3 times more likely to die during pregnancy than their white counterparts. So I think that statistic is important for us to spend some time in, because we've got to get upstream of it and figure out how we can help folks. And then the other is just about access. It's just, we've got about 31% of our counties here in the Commonwealth that don't have an OB. And if you think about communities of color, a lot of times we do have folks who don't have a usual source of care or don't have a provider for their prenatal care. And so that access piece dovetails with the mortality piece. So those are two things to shine a light on.
When we talk about systemic oppression, inequalities, inequities within the system that manifest themselves in some of the statistics that you're talking about, can you sort of identify some of those specific instances that we're trying to sort of pull out root and stem to solve this issue?
Yeah, I think that in the provider community, we talk a lot about making sure that we're meeting our patients' individual needs. But in the discourse around Black maternal mortality in particular, there's a thread of women talking about not being heard or believed when they describe some of the challenges they're experiencing during or after their pregnancy. And I think that kind of working to deconstruct that, to understand why we're having challenges with communication in that way, and it has really bad outcomes when it ends with multiple mortalities far beyond what their white counterparts are experiencing. So I think that's where we want to spend some time in just acknowledging that bias plays a role, and physicians aren't immune to the impact of bias in society. It's not that alone, but when compounded with the access issues, with transportation challenges, with the burden of chronic disease, when you layer on top of that the role of providers and not necessarily always hearing or believing their patients, so then we've got the challenges that we're seeing.
There's a couple things that I want to stay on there from that answer. I want to start with something you said towards the end, the burden of chronic disease. Can you maybe describe how that disproportionately impacts the Black community and how it manifests itself in maternal health?
Yeah, in the Black community, we see high rates of hypertension or heart disease, diabetes, and we see high rates of obesity. And when you take those chronic conditions and you put them in the context of a pregnancy, we tend to see more challenging outcomes, whether it's preterm births, so earlier deliveries, low birth weight infants, but also some of the maternal mortality that we see when you have the confluence of really all these different conditions coming together. And so a lot of times we would say this is a high-risk pregnancy or a high-risk individual in pregnancy. And sometimes that requires specialists, right? That requires individuals who have a lot of experience navigating these conditions in pregnancy. And we don't have the providers in all of our communities to meet those needs. And so I do think that burden of chronic disease, which is layered, we see that across the Black community, but I think when you layer that on top of pregnancy, particularly challenging.
And when we talk about sort of getting to that end point and having enough specialists who can tend to the needs of, expecting Black moms. We're talking about sort of a solution at the end. If we go back to the beginning, which is that burden of chronic disease, has there been any research in the Virginia Department of Health or in your work that you've done where there are solutions to getting rid of that burden before it even starts?
Yeah, that's where a lot of our work in public health is. It's trying to make sure that we're addressing those conditions, those circumstances that lead to increased burden of disease. In a lot of instances, it has to do with the food environment that people are in. A lot of instances, it has to do with access to primary or preventive care, right? You're not dealing with diabetes heading into pregnancy if when you first were identified as being at risk, having pre-diabetes, we were able to get you on a regimen that helped you, avoid progressing to actually having diabetes. So I think a lot of the work does start in that primary and preventive care space. I think it is us thinking through those social determinants of health, those drivers that impact health outcomes as well, understanding and acknowledging family history and the role that plays so that people navigate these conditions early. But I don't want to center on kind of individuals being to blame, because I do think that, it still is those access components. Even when we control for a lot of these different dynamics, we still see worse outcomes for Black mothers. And so I think that it's nothing inherent about being a Black woman that's pregnant. It has everything to do with systems and structures that ultimately interface with the experience of being a Black mother. Sometimes it's stress, sometimes it's access, sometimes it's chronic disease, sometimes it's bias. You put all this together, those ingredients really can lead to some challenging outcomes. And that's what kind of Black Maternal Health Week is about. It's about shining a light on that and helping to find solutions to move forward.
And we talk about those systems, and I think you mentioned the phrase lack of belief at one point. Can you expand on that? Maybe how does that factor in? I didn't expect you to say lack of belief. That's upsetting to even hear, because I can imagine how stressful that would be when you are not being believed as you talk about the challenges you're facing.
Yeah, no, I think that's absolutely right. And I think a lot of that has to do with the relationships folks have with providers beforehand. So if you don't have a usual provider, they don't know you. They don't know kind of how you experience your body or how you experienced your pregnancy. And so telling somebody who's brand new to you that I just don't feel right in the days or weeks after pregnancy doesn't always land the same way. There have been a lot of, kind of famous instances. Of course, Serena Williams was one of those instances of a Black mother who kind of described her experience and felt like the providers she had weren't always hearing or seeing what she had to say or believing what she had to say. And so I think for a lot of folks, we say it's critical to have providers who you know, who you trust. And in all communities, that's the goal. It's just we don't always have the providers. And so that's one of the things we're looking at across the Commonwealth. How do we get the providers into communities so people can build these relationships? At the Virginia Department of Health, we have some of our health districts where they provide prenatal care and prenatal services. And I think that's one of those spaces where we serve as a safety net. But in other communities, it's other partners, it's federally qualified health centers or community health centers, free clinics that do some of that work. So it's figuring out what's the right fit in your community, but how do you make sure you know providers and they can kind of keep track of what your needs are so that when or if something goes wrong, you're believed, you're understood, and you feel like you're valued.
Yeah, and feeling valued, I think, is really important, because this is it's such a vulnerable space, I would imagine. Right. How does the natural situation of, what a challenge it is to create new life and to, carry that burden, and obviously people may be willing to help you within your community, but there's nothing like having to do that yourself. How does the very nature of what someone who is pregnant is trying to accomplish affect their ability to go and find proper health care?
Sure. And that's a challenging question, and I'm sitting here acknowledging as a man, I haven't navigated that situation, but I'm the son of a Black mother and the husband of a wife who's a Black mother, right? I have these experiences I've been around, and I do think that these stories, these experiences of kind of the healthcare system, particularly during pregnancy, they can be challenging. And I think when you add that to an already stressful and challenging dynamic of pregnancy and all that comes with it, I think it's tough. But when we talk about creating access, it really is, as an agency, how we leverage data to identify where are there gaps. We talk about, maternity care deserts. Where do those exist? What are the patterns that people are currently using to access the care that they need for prenatal services? And then how do we fill in some of those gaps to make it work better? Not just putting something there, but putting something that actually meets people's needs and is acceptable to people. I always say that access is more than just having an insurance card, right? It's about having care that's, approachable, acceptable, available, accommodating, affordable, right? All those things together. And I think there's a lot of factors that go into that to create access. And I think for Black mothers, you see different stresses on all those different aspects of what access is.
And we talk about access. We talk about, you mentioned a maternity care desert. Over the last 18 months, we have done a lot of reporting on local hospitals, regional hospitals that are in danger of having to shut down due to a lack of funding because of some changes in our system, whether it's Medicaid or Medicare. I'm wondering, have you noticed that are there more and more sort of maternity care desert risk areas that are appearing as we see some of those hospitals' very existence get threatened?
Yeah, certainly I've been hearing that from some of our healthcare partners, both, identifying where they had to close labor and delivery units, but also identifying where there's ongoing risk. And if you put that in the context of some of the changes we have coming to the Medicaid program, the reality is that we expect hospitals, health systems to lose billions of dollars here in the Commonwealth over the next couple of years because of the changes to the Medicaid program. And when that's the case, it puts stress on some of these aspects, the areas of care that are high cost, and labor and delivery is one of them. So part of our work and part of the reason we're having these conversations with providers is we have to think through the broader ecosystem. How do we make sure that even though the cost is there, how are we supporting systems and finding efficiencies, finding ways to collaborate and coordinate so we can keep care available for Virginians? And it's not easy, right? I think that in the absence of resources, it's not possible. But that's why I think the governor is doing a lot of work in this space, trying to identify where we can do more. Here in through the Virginia Department of Health, we just launched these perinatal health hubs. So that was $2.5 million that's going across a couple of different organizations across the Commonwealth to try to support this work and try to support keeping folks who are expecting wrapped around with resources. And I think that we're looking at what are some of the creative solutions we can bring to bear to fill in some of these gaps.
And we talk about this is a quote directly here from when we were setting up this interview, a future liberated and rooted in restoration, justice, and joy. I want to focus on that last word. Why is joy such an important part of what you guys are trying to do?
Yeah, I think the experience of bringing a child into this world, it's often reflected upon as being one of the most joyful moments, right? But when you wrap around that, so many of the challenges with access or so many of the fears that come with the data that we have around maternal mortality, I think it can rob some of that joy. So I think our focus is saying, how do we bring resources, supports, tools, how do we navigate this experience in these environments using everything that we have to allow folks to focus more on the joy. And I think that starts with ensuring that there's some equity, there's some justice, there's really a focus on addressing and redressing some of those historical wrongs so that we can kind of create a brighter future.
And, is there any specific initiative that you are looking to embark on to correct those historical wrongs that you're able to tell us about now? I know you're just we talked about 3 months. I know you're just getting started, but.
Well, I don't want to get in front of the governor, but I know she has some stuff that she's been working on. Certainly, the General Assembly has been doing some work in this space. So I do think there's been some attention on maternal health in particular across the Commonwealth. Even in the Youngkin administration, the prior administration, they did some work in the maternal health space, and they launched some dashboards trying to bring more data into this space. So the good news is this is a nonpartisan issue, right? Everybody agrees that we want to put resources toward maternal health, and I think Governor Spanberger wants to take that even a step farther. So I know there's some work she's doing there. I already mentioned the perinatal health hubs, something we launched from the Virginia Department of Health with that $2.5 million. And so these are early steps. I think there's a lot more to do. Certainly it's going to require some partnership, some opportunities to partner federally, and I think we want to continue to have those conversations. But I think we're going to start by doing our part and see where we go from there.
Okay. Is there anything else that we need to know that you want to add here? Well, we've got you.
Well, it's also National Minority Health Month, and so there's a lot of attention more broadly on the health needs and concerns of communities of color. So I think we're highlighting here maternal health, but it doesn't mean that we're taking our eye off the ball on kind of the full range of issues and dynamics that face communities of color. So we'll continue to do the work. We're eager to hear from communities about what's important to you, and so thanks for all the engagement and all the collaboration to this point, and we'll keep rolling.
A lot of work to be done, clearly, from talking to you, but we're certainly excited to see you do it over the course of your tenure, which, again, is just getting started here. Dr. Cameron Webb, the Virginia State Health Commissioner, a major privilege for us getting to have you here in studio, and hopefully we'll see you again down the road.
Absolutely. Thanks for having me.
All right, Dr. Cameron Webb, once again, just over 3 months into his tenure, and obviously a lot of initiatives that we are looking forward to the Virginia Department of Health accomplishing. Now,